So you've been scratching all over, everywhere, and you're concerned there's parasites living on your skin or inside your body and there's something terribly wrong with you. Before you go down the rabbit hole, take a pause and watch this video to sort out what could be causing your symptoms and what are the best solutions. Dr. Yuval Bibi, dermatologist, mission: break you out of the skincare matrix of horror films, fall medical documentaries, and get you real life relief for your itch. Here are the leading causes for itching all over. Before we get started, a disclaimer. This video is in no way, shape, or form a substitute for good old-fashioned medical diagnosis, advice, and management by your doctor. It is for educational purposes only. So while scabies is not the most common type of body-wide itch, it is probably one of the most frequently talked about causes. Scabies is caused by a mite that burrows in the superficial skin, feeding on dead skin material, laying its eggs and multiplying in the superficial layers of the skin. Scabies is particular to the skin folds and is almost exclusively a below the neck problem, meaning it does not occur on the head and neck. Most frequently, it occurs over the skin folds, meaning the armpits, the belly button, the groin area, the butt crack, and in the spaces between the fingers and the toes. As the condition progresses, it will inhabit other parts of the body. Now, scabies does start as an itch and eventually develops tiny red bumps over the itchy areas. And in very severe cases, scabies can turn into crusty areas that are exceptionally itchy. This is called Norwegian scabies. These are very rare cases and usually involve some type of an immune compromise. Scabies responds to anti-scabies creams such as permethrin, and in more severe and involved cases, the treatment may require addition of systemic ivermectin to treat the problem from the inside, with the medication reaching everywhere on the skin. Unless there's an active source of reinfection, as in a close contact that carries the mite and reinfects you, or soiled linen or other types of fabric in your living environment, scabies can be cleared and cured with 2 treatments a week apart of the permethrin cream and, in more severe cases, permethrin cream and ivermectin tablets. Obviously, make sure that everybody around you who could be a potential carrier is effectively treated, and that your soiled sheets and used clothes are laundered in hot water to get rid of the mites that may inhabit those fabric surfaces. If you're still itchy despite multiple treatments for scabies, chances are you don't have scabies, especially when there are no red tiny bumps involved. But what else can it be? Another parasite? Well, if you have many red bumps that appear like insect bites and turn up in lines of 3, chances are you're dealing with bed bugs. Bed bugs are tiny insects that bite people at night when they're sleeping in their beds, feeding on their blood. They're almost impossible to spot as they are very small, about 3 to 7 millimeters in size, about the size of an apple seed when they're fully engorged. Bed bugs will not respond to anti-scabies medication as they do not inhabit the body. They inhabit parts of the house and come out at night to feed and bite and then go away and hide away where they do. The bites themselves will respond to steroid creams. And the infestation, if there is an infestation, must be addressed with the help of an exterminator that will come by and check out the house. This is the most effective way of dealing with the problem rather than burning down your mattress, which is something I've seen patients do. Now, it's important to realize that bed bugs are not a hygiene problem. They don't really mean that you're not a clean person. They can get inside the house in a variety of ways, and none of which have anything to do with hygiene. They could come with you in your luggage as you were traveling, maybe staying at a hotel that was infested or some relative's home that was infested. And they could actually migrate from home to home, making the trek from one house or one apartment to the next and getting into the house or the apartment under cracks in the door or through open windows. If you don't have bed bugs, why else would you be itchy? Hives could be another possibility. Hives are red, itchy bumps that could appear anywhere from head to toe. The hallmarks of hives is that they look swollen, almost like insect bites, and they come and go pretty quickly within hours or short days after they appear, all by themselves, coming and going spontaneously. Hives can be caused by a variety of problems. The most common one is idiopathic, meaning of unknown origin, but they can appear due to an allergic reaction to external or internal allergens and as part of a post-infectious syndrome after an upper respiratory tract infection or stomach flu. Then there are other causes of hives that are less common. Most hives respond really well to antihistamines, such as levocetirizine, for example, which is an over-the-counter medication in the United States, which in rare cases may lead to drowsiness. If your hives are severe or associated with systemic symptoms like trouble breathing or GI trouble, won't respond to antihistamines, or won't go away after a period of 4 to 6 weeks, all those cases will require evaluation and management by a dermatologist, sometimes with prescription medications. Another common cause of widespread itch is dry skin, leading up to irritation and eventually eczema. Dry skin can be the result of excessive cleansing with detergents and with scrubbing devices and physical abrasives, as well as the result of certain medications such as statins. Dryness can be addressed by eliminating any drying factors as much as possible. First, by using lukewarm water in the shower, soaping only under the skin folds for body odor as in armpits, groin, and butt crack, never scrubbing the skin with any physically abrasive device, as those are completely worthless, and moisturize with an oil-based thick moisturizer such as Butter Oasis or Butter Blossom. Link in the description. Use those moisturizers twice a day over strategically dry areas. This will decrease the itch almost immediately. If your dry skin and itch do not respond to simple avoidance of abrasive practices in moisturizing, see your board-certified dermatologist for additional evaluation and management. It's important to note that certain medications can be responsible for significant itch over the body. Medications such as opioids used to treat chronic pain are an excellent and frequent example causing itch. But what if you don't have scabies, you don't have bed bugs, you don't have dry skin and eczema, and you don't have hives? What else could possibly be causing your itch? Well, most of these cases fall into what's called primary or secondary itch. Primary meaning itch that has no known cause or traceable cause. And then there's secondary itch to a variety of systemic conditions. Those conditions include, but are not restricted to, iron deficiency, thyroid problems, liver disorder, kidney dysfunction, and more rare problems such as chronic infection with HIV, tuberculosis, or hepatitis C, and even certain types of cancer such as lymphomas, specifically Hodgkin's lymphoma, can be associated with severe itch, as well as other more rare conditions such as multiple myeloma. That's when a visit to your dermatologist can make a huge difference. All the problems that I mentioned can actually be found by a series of simple blood tests and additional labs as needed. Then, if a problem is found through the lab work, it must be addressed, and the itch can be addressed in addition to the problem itself. With many of those problems resolved or brought under control, the itch will likely resolve or diminish significantly as the problem itself is being addressed. Now, if the blood work or the lab work did not uncover anything, then you're likely suffering from primary itch or primary pruritus, meaning pruritus without a clear cause. Those cases are also treatable in a variety of ways, specifically through prescription medications such as naltrexone, gabapentin, pregabalin, and butorphanol, for example. And then there's other techniques such as narrowband ultraviolet light that can be used in the office or in certain cases at home as well. To summarize, widespread itch can be caused by a variety of problems, and while parasites are possible, they're usually not the cause. In any case, your best bet is to stop the Google or the ChatGPT deep dive, march into your friendly neighborhood dermatologist's office with an open mind, and manage your condition. In my experience, there are very few cases that cannot be managed to the patient's satisfaction in one way or another. All you need to have is the right key. Let me know in the comments section what type of itch were you suffering from and what treatment worked for you. Also, don't forget to share, like, and subscribe for more no BS skincare advice. See you next time. God bless.